How's it going, everybody? My name is Jesse and welcome back to Male Nurse Mentor. Today I got a video that I think you guys will enjoy, even if you're in school, but especially if you're out of school. This is a good tip video for you. So let's begin. So this one is the importance of career trajectory. In this video, towards the end, I'm going to give two examples, one of a non-clinical pathway and one of a clinical pathway. Typical timelines, timeframes of what to expect regardless of which pathway you select. So let's talk about it. But before we get further into this video, friends, I always like giving you the purpose of the video. I just want to explain that in your career as a nurse, you're going to realize two things. One, your career is your responsibility, and two, most people around you aren't thinking about their next steps in their career. Many, you'll realize, just go with the flow and aren't planning their timeline, which is perfectly fine, but not everybody is this chill. Some people have a bigger vision picture, right, of what their future looks like. They already know from the jump. They know exactly what they want to do, or some honestly just get tired of working bedside quite early on, like myself, and have to find something else to do now that they started working as a nurse. And I'll raise my hand to that. I found that out pretty early on. So because of that, planning a nurse career path can set you up for a positive outcome, as opposed to not doing it at all. And you'll see what I mean as we make our way through this video here today. So friends, first things first, I want to say that there isn't anything wrong with working as a floor nurse for the duration of your career. Many do in fact do this. But the problem that I've seen is that because many don't plan their career trajectory early on, once they start working as a nurse, at some point it does become harder and harder to go back and plan. Whether it's plan to go back to school for a master's degree or become a higher level provider like an NP, life itself gets very busy just naturally as we age. And it can be quite common that one just doesn't have the mental bandwidth, the energy, once we get many years and years into the workforce. I've seen in my own career, the further away from graduating nursing school, the harder it becomes to actually go back. But whether it's to go back to school or methodically plan, a route to get that nursing promotion that you've always wanted, or one that you thought of later on, it does help to come up with a vision or a path with a timeline to keep you on track and to keep you focused. And since we're talking about career advancement in this video, some examples or types of promotions to expect can be charge nurse, nursing supervisor, nurse instructor, DON, which is director of nursing, CNE, which is chief nurse executive, nursing consultant, NP, which is nurse practitioner, FNP, which is family nurse practitioner, PMHNP, which is psychiatric mental health nurse practitioner, or NA, which is like a nurse anesthetist. There are quite a few of them. You can do a lot with the nursing degree. And just to be transparent with you all, I myself have been a nurse for 5 years now. I've gotten my BSN, my MSN, and I've been a nursing supervisor. But I'm back to working on the floor as a floor nurse as I look for my own next job opportunity, right? My own personal promotion. Turns out I actually didn't really like being a nurse supervisor. So we'll scratch that one and we'll look for a different one. But with all that being said, friends, I want to now take the time to explain two common pathways of career trajectory, giving examples of a non-clinical pathway such as admin, right, nursing administration, which is the one I personally decided to pursue, or the clinical pathway, which is like NPs or the nurse anesthetist. So first, for either route, right, it may be obvious, but you will need to be an RN first. It can all be quite confusing at the very beginning. So my recommendation is, if you're someone like me, you like thinking a couple moves further ahead, but you're still in school and you already know you want to advance in career development, career trajectory, get an advanced nursing degree, I say for the time being, keep your vision alive, but graduate and get your RN license first, and then really start to plan your route. So starting with non-clinical, a pathway and some tips. Examples are DON, CNE, nursing supervisor, nurse consultant. You are now an RN. My recommendation is to work on the floor for at least 2 years before you consider doing this pathway, before you consider going back to school to get your master's. And I say 2 years, but you can definitely do more. I had 2 years when I went back to get my master's degree, and that is the soonest amount of time I'd recommend. At least for my degree, there wasn't necessarily like an amount of time I needed, but that's the amount of time that I felt was best. I was one of the youngest people in my cohort, right, for my master's. And anything sooner than that, it becomes harder to pull, right, for your work assignments, school assignments, any prior work history, right? that then you can apply to your program. Most of my program, to be honest, were noticeably older than me, and I went to WGU if you're curious. Super flexible. If you have any questions about them particularly, you can always reach out to me. I got you. Another thing, the floor you work on doesn't really matter on this pathway. The experience that you do get doesn't really impact the career trajectory for this too much, because the skill set that you're trying to obtain is skills that don't apply so much to bedside manner. It's more of administration side manner, if that makes sense. It just doesn't matter as much. Another thing is work on making connections and building rapport with nurse leaders. And this one should have a big bold star next to it. So as you're working on the floor, you want to connect with these CNEs, the DONs, the nursing supervisors who are already working on the admin side of nursing. You want to get recognized. You want them to better know you. You want to get to know these people. This part is very important, and it will help you later down the line, especially if there's nursing admin spots in a specific hospital that you work in or a specific facility you work in that you want to climb in. This part is pretty important. A lot of weight going to be placed in this particular part here. So let's say you graduate with your master's degree. You finally get it right. You got your MSN, and the next step is just looking out for opportunities as they pop up. Sometimes there aren't very many, right? CNEs, DONs, nursing supervisors. Sometimes these positions can revolve, but to land one, especially as a newer nurse with limited experience and a master's degree, it could still be challenging. But just keep your eye out for opportunities. They do pop up, and again, the thing that matters is making connections with some of these nurse leaders. That's the last thing that can get you over the top into one of these spots. I do have to say this route of nursing is quite political. Some people are gonna like that, some people aren't. And it's just political in the sense that in order to kind of get into the admin side of nursing, right? This other side of nursing away from bedside, to climb that ladder, relationships, building rapport with some of these individuals carries a lot of weight. Not even admin on the nursing side, admin in the side of the facility too, like the CEO. On the medical side of things, getting to learn the medical director, all those things help. It's honestly a quite interesting, facet to the nursing world. I was exposed to it pretty early on, and I saw the benefit of making connections. And that's all I'll kind of say on that side of things for now. But I can say you honestly don't need an MSN degree, right? A master's degree to do this pathway, but it does help, especially if you're a younger nurse looking to climb that ladder. It will keep you competitive amongst the older nurses who are also applying for these positions, who honestly hold a lot of years of experience, but may not hold that degree. Because as a younger nurse trying to get into one of these spots, you're going to compete against experience. And that's kind of hard to compete against. So it's just something to keep in mind. So now moving on to the clinical route, a typical pathway and tips. Examples are NP, FNP, NA, nurse anesthetist, or PMHNP. That's always so hard to remember. Psychiatric mental health nurse practitioner. So for this route, I say still work at least 2 years on the floor as a nurse. This can be on any floor for an NP, but changes when you want to become a nurse anesthetist, as those programs often require like ICU experience or critical care experience specifically. And to get into a psychiatric mental health nurse practitioner program can be another one that requires some of this specialized experience, right? Working as a psych nurse for those 2 years can benefit you a lot when you're trying to get into one of those programs. So I say 2 years is the minimum. Most programs require 2 years. Anything more than that will only help you because you're still on the clinical side of things. The more clinical experience you have going into these programs, right, on the clinical side of things, it'll only help you. But once you get your 2 years at least, which I believe is what most well-known programs require, you can begin to apply for schools, whether it's NP school, nurse anesthetist school, psychiatric mental health nurse practitioner school. You get in, get done, get out. Easier said than done, I know, but that's it. That's the pathway for that. You come out as a higher level provider, right? A mid-level provider. And now you can prescribe and do your thing, right? Really awesome. Sometimes the journey for this pathway can take longer depending on how soon you can get onto that floor that you need to get on, right? Like for a nurse anesthetist program, trying to get into the ICU, if you have some trouble getting into that floor, that can kind of take up some of the time and things like that. How I'd say this compares to the non-clinical pathway or the non-clinical route is this is much more straightforward. As like I mentioned, the non-clinical route can be more political in a sense. who you know, building those relationships, building that rapport, waiting for those opportunities and those positions to open up. And if they don't open up, you can't land one. As opposed to being like a mid-level provider, like an NP and NA, you still have to wait for these positions to open up. But oftentimes once you have that in your hand, right, that degree, you can look for these positions, apply and get in. You don't have to be so political in the sense of trying to land one of these spots and climb the ladder. The admin side is a lot of climbing that ladder. Depending on how high you want to climb. It's a different side of healthcare completely. Some people like it, some people don't. Some people like the bedside and clinical side, some people don't. So it's just a matter of finding out which side you like more for you and think about it. You know, there's no rush. Anyways, friends, that's gonna be it for this week's video. Just showing you two different pathways, trying to get your mind to expand, to think about things like this in terms of career trajectory. If you're in school, just think about it a little bit, but once you graduate, that's when you actually have to decide, right? That's when the pressure is on. And if you're in the nursing field already and you haven't thought of this before, think about it now. See your career as a path, as a journey. See where you are today and where you want to be in a few years. You'll thank yourself later, right? If you continue to implement steps to get there. Think about it, think about it, think about it. Can't stress that part enough. But as always, friends, I'm here if you need me. If you have any questions at all, you want to bounce off ideas, you want any second opinions, message me on Instagram in the DMs, or you can comment down below. I'll comment back to you here as well. As always, friends, see you guys on the next one.